Thank you for coming. My name is John Schreiber. I'm the CEO of the Arts Center, and I'm happy to welcome you to this morning's Business Partners Roundtable. We have a really fascinating program for you today. We'll be discussing the future of healthcare with somebody who is right in the thick of this changing field, and that is our friend, our board member, Gary St. Hilaire, the president and CEO of Horizon Blue Cross Blue Shield of New Jersey. He is there sort of as far away from the stage as possible. You know, don't leave, okay? Please stay, will you? Before we begin, I want to thank our friends at PNC Bank, the sponsors of the Roundtable series, and to our breakfast sponsor, PSEG. And roundtable events like today's conversation are one of the many benefits of NJPAC's Business Partners program. We thank all of you who are business partners. If you are not, there's a wonderful woman right there. Her name is Val Blau, and she will help you become one at a price you can't refuse. So, yeah. Our Business Partners Committee members are our guides who help us enormously as we plan these events, and I want to thank the members of the Business Partners Committee who are here today, including Justin Edelman of RWJ Barnabas Health, Ryan Gates of PNC Bank, John Pearson, our co-creator of today's event of Horizon, and Lori Spoon of Berkshire Hathaway Specialty Insurance. And a special thanks in particular to Joel Sherman, who is the chair of our Business Partners Roundtable. He is one of the leaders at Atlantic Tomorrow's office, and thank you for being with us. And since Josh Weston is not here, you get to ask the first question. Okay, all right, okay. So I'm happy to tell you the Arts Center has never been busier. We have more than 100 shows on sale right now, including some wonderful performances coming up very shortly. This Saturday afternoon, the New Jersey Symphony will conclude its epic run of presenting all the Harry Potter films with those magnificently spooky scores performed live when it presents Harry Potter and the Deathly Hallows Part 2. Now, if you enjoyed Part 1, you know, it's like, really? Part 2? Who here has seen all the Harry Potter films? Wow, Jesus, where have I been? You know, what's wrong with me? You know, it's like, oh, wow. Okay, well, there you go. And then on Sunday, Lake Street Drive, the jazz, pop, and folk fusion band will be here. February 18th, Gregory Porter, who's, I think, the best working jazz singer in the business, will be here. And the Czech National Symphony Orchestra will be here the next night on February 19th. On your tables, there's information about Philip Roth Unbound. Philip Roth Unbound is a 3-day festival celebrating, illuminating, examining the work of the great novelist who was Newark born. We have over a dozen events here at the Arts Center. Our partner is the Newark Public Library. A lot of fun. One of the highlights will be a reading by 9 actors, including Mary Louise Parker and Tony Shalhoub and others who were in that thing, of The Plot Against America, the wonderful book that Roth wrote where he imagined what America would be like in 1940 if Lindbergh defeated Roosevelt for president. So that'll be a staged reading of The Plot Against America Sunday afternoon, the 19th. So, on with the show. I am happy that we're able to have an in-depth discussion with a remarkable business leader, Gary St. Hilaire. Gary spent more than 30 years as a healthcare executive, entrepreneur, and financial leader, and he's held roles in executive leadership, strategy, startup operations, acquisitions and divestitures, and business turnarounds at a number of organizations. Under his leadership, Horizon is leading the transformation of healthcare in New Jersey through its collaboration with physicians, hospitals, and health systems. Before joining Horizon Blue Cross Blue Shield of New Jersey, Gary served as president and CEO of Capital Blue Cross for nearly 8 years, transforming the local health plan into a national diversified family of companies. Before being named CEO in 2012, he also served Capital as president, EVP, and chief financial officer at the company. And prior to his work there, Gary co-founded the healthcare technology company ChoiceLinks. He also served in executive leadership roles with Blue Cross and Blue Shield of Massachusetts. And on top of that, and here's the best part, he and his wife Sylvie are the proud parents of 6 children. Okay, so, you know, I'm not sure how you accomplished it. Well, actually, yeah, but 6 children and all of this, it's quite a resume, my friend. Anyway, please welcome Gary St. Hilaire. Come on up. Now, I should tell you that we had a pre-call, and he said, well, what should we wear? You know, you're going to wear a tie, you're not going to wear a tie, you know. I said, don't worry, I'm not wearing a tie, right? And then, of course, because I can't remember, you know, what I had for breakfast, I wore a tie. And Gary said, what are you doing? And I said, well, you know, I need to class up the room because we have a, you know.
So I asked him, why did you invite me then?
Yeah. All right, so let's start just with your background. Where'd you grow up? Where'd you go to school? How'd you decide to have 6 kids? You know.
Well, I grew up in a little place, Goffstown, New Hampshire. I grew up in southern New Hampshire. Mm-hmm. And I can proudly say, and I look back on it, I wasn't thinking of it at the time, but I came from pretty humble means. I was actually number 6 of 7 kids.
Now
so,
there's a trend. Okay.
Yeah, there was a trend. And I had a wonderful childhood, I have to say. I loved growing up where I did. And I, you know, I had to put myself through school. My parents didn't have the means. And I had an older sister who went and did a few semesters of school, but I was the first one to really go to school full-time and try to make that a go of it. So yeah. I went through that. I met my wife while I was in school. She was already out of school. And how we got to 6 kids, I will say, when we actually sat down, we were doing marriage prep, we were asked how many kids we would like, and I said, you know, 3 would be nice. My wife said 1, so I say we compromised. And we ended up with 6. Yeah. But it's absolutely wonderful, and we moved to Pennsylvania in 2005 after the ChoiceLink startup. We had sold it, and an opportunity came up to take the CFO role, and that's how we ended up in central Pennsylvania.
So tell me about the beginning of your career. You started at Deloitte & Touche in finance and healthcare. How did you originally transition into healthcare? What was interesting to you about that?
Well, I had a client at the time when I was with Deloitte. So not to age myself, but at the time it was Deloitte Haskins & Sells. It merged with Touche Ross while I was there. And I had a client, HealthSource, which was a fledgling publicly traded managed care company, big into HMOs. And an opportunity came up there as a finance manager, and so I decided to take it, you know, thinking, okay, you know, I was married now and just had our first child, and life as in public finance wasn't exactly, you know, scintillating for 60 to 70 hours a week during, you know, 6 months of the year. So that's how I got there, and I've loved it since. Mm-hmm.
So your position at Horizon was announced in mid-February 2020.
Timing.
Let's think about that. Right. Yeah. Think about that. So, you know, why were you excited to take on this particular position, and what did you think was going at that time, a month before the world shut down, right? What did you think was going to be your biggest challenge as the new leader here?
I was excited just because I 2 things. One, Horizon Blue Cross is depending on which day you measure it, the 6th or 7th largest blue in the system in the country.
How many blues across the country?
34, actually, with an announcement recently. It'll go down, I think, to 33, with Louisiana looking like they're going to join Elevance, or what was Anthem. Mm-hmm. So yeah, there's 34 now. But you know, I looked at the opportunity and I thought 2 things. One, it's got a terrific reputation. A lot of work had been done in the area of value-based care, so Horizon had a terrific reputation as a leader in certain innovation areas within the Blues. And I just think I was at a point where it was a real exciting opportunity. It was hard to pass up. When I look at what I thought the challenge was going to be, I thought, every market's different, and New Jersey was going to be different, and it would take time to get to know folks. I'm a big believer in if you're going to get things done, you have to build relationships. So I assumed the first couple of years would really be focused on trying to build those relationships and spend lots of time with my colleagues
lots
in
of time,
person,
dinners,
and then really just contribute to the continued success at Horizon.
All right, so by the time you actually took office in April of 2020, things had changed. Talk to us about how you navigated the company through the pandemic.
Yeah, so my first discussion with employees was via a video, a recorded video, in order to connect with folks. The first 4 months were mostly conference calls. So there's a few people here from Horizon, and they were probably wondering, who the hell is this guy, right? Because you can't even see him. And then we finally got to Zoom.
Right, the Wizard of Oz.
Yes.
Right, yeah.
And so it was absolutely a challenge because, again, from a relationship standpoint, you're trying to connect with people. And while you can meet folks and get to know them a little bit, it's very different when you're doing it on Zoom or WebEx or Microsoft Teams or whatever you're using. And so that became a challenge. So I was excited when we had the opportunity to start coming back. I looked at what we were faced with, and the team was already in place to go, completely remote. So taking 5,500 employees and saying, okay, everyone's going to work from home now. So you had everything from IT and system folks and trying to make sure everybody had the right security, the right laptop. They were in the midst of all of that and did a terrific job. So we then had to focus, in addition to getting our employees, productive and working well from home, we had to figure out what we were going to be doing in the marketplace. So we had all kinds of changes. I think people recall. I mean, there were things that we had to implement around waiver of co-pays and how we were going to look at telehealth. There were all kinds of challenges. We were also, John Pearson and his team were working very closely with others around a lot of the significant contributions we were going to be making around masks and medical equipment. So we spent millions to give back in that regard as well, while we were also trying to navigate what is this going to mean for our members, what is this going to mean for their premiums as we go forward. So 2020 and 2021 were difficult financial years because of all of that, and none of that stuff was built into rates. And at the end of the day, premium is healthcare financing. It's just taking the cost of care and spreading it out. So, but I think I feel very good because we did what we knew was right, and you always win when you do what's right.
Good. It's a good motto, and it's true. What was the hardest part? What was the biggest challenge you faced during pandemic in terms of either team members or customers?
I really think it was kind of making more of that personal connection. I look at, even with our members, we're really focused on trying to deliver an incredible member experience. I think one of the benefits to being not-for-profit and being locally based is that we can do certain things. We reach out in certain ways, and all of that was challenged in our new world. In the same way, it was challenged for all of us working together.
Sure.
I think I met certain members of my team in person for the first time about a year and a half into my tenure.
Crazy, yeah, crazy.
So it was challenging in that regard, but at the same time, we learned a whole lot from it. So I'm a big believer in look for the positive where it comes from, and it taught us how to work more effectively remote. That there's certain things that we could do where we could really go out. We've hired some incredible talent now that may not live locally, but now they're adding incredible value to the company because we can do some things remotely that we couldn't do before.
So those 5,500 employees, everyone was working remotely. Everyone was delivering services well to customers and collaborating well as colleagues. And now that we are out of pandemic, a lot of us are trying to determine that balance between work from home and work in office. What's your take on that as it relates to Horizon?
Yeah, we've gone to a hybrid at this point, so we do have some employees that work primarily from home. We have a vast majority of our employees are in some form of hybrid situation where they're coming into the office, 2 or 3 days a week. There are a few people that come in, 4 to 5 days a week because of the nature of their work, requires them to be more on site. And I think, I know there's certain companies that have gone completely remote, and others who have said, no, we're requiring everybody to come back in the office. And I still think we're waiting to see. I think that there is a balance in there somewhere, and I think if we can do it effectively in a hybrid situation, it allows us to attract people that are interested in not having to make a commute every day, into the office. But at the same time, we like the benefit of like what we have here today, people getting together and collaborating. There's no way to kind of replace that. And we see it. We've had events where people came in and it was almost like these reunions. So even now as people come in for different things, some people haven't seen, other people in, a year or 6 months. And so it makes a difference as people are working. So we're trying to find that balance. I don't expect that we're going to be back to what we were pre-COVID.
I think you're right. I mean, I think probably most of us in the room would agree to that, right? I think we're not going back to where we were 3 years ago. Right. In the old days, pre-pandemic, I wouldn't imagine hiring somebody who wasn't going to come in at least 5 days a week, maybe 7, So, and that's changed.
Yeah, 5 days part-time, right?
Yeah, exactly. It's in our business, So Horizon recently changed its corporate form to a not-for-profit mutual holding company. Explain what that means, and then what does this change do regarding opportunities for the business going forward?
Right. Well, the key part of that is the front part is not-for-profit. We've retained our not-for-profit status. So nothing changes in that regard. Going to a mutual company, we had a unique situation where we were the only company, healthcare company, that was under that particular statute. So we had certain rules and certain taxes that applied to only companies that were incorporated under that provision. And of course, being the only company incorporated under that provision, it meant we were at a competitive disadvantage with others in the marketplace. And so moving to a not-for-profit mutual puts us now on a level playing field, and it allows us the opportunity to invest in some things that we couldn't invest in.
What type of investments?
Well, things like, for instance, we've launched a behavioral health entity, NovoWell, where we've really tried to reimagine what we're doing with behavioral health and the benefits associated with that, and integrating it more into the delivery of primary care, understanding that there's really not a separation between when we talk about our mental health and our physical health. They're really connected. Social determinants of health, there's some investments we're making there that if we were investing in a company under the old provision, it really wasn't for healthcare premium dollars, wasn't insurance dollars, so we were limited as to how much we could do. We have the capability now to invest in ways, in the same way that, quite frankly, our competitors, that shall not be named, of course, invest in other areas to deliver services that are very much adjacent and important to innovation and provision of healthcare. We were very limited in that regard, and we don't have those same limits now.
And what does this mean for customers?
Well, I think what it means for customers is, in addition to long-term relief on some of the premium, and we were paying $65+ million a year in a premium tax that no other competitor was paying. That had to be factored into our premium cost, right? So the fact that we can do that, but more importantly, the fact that we can invest in innovation and do some things that will long-term be focused on working with our partners to make sure that people are getting the right care in the right place at the right time, much more cost effectively. I think it's going to yield a better result at the end.
So one of the areas of interest and expansion that you've identified is a focus on behavioral health. We're, of course, happy to be involved with you as we advance an arts and health programming vertical here with you and Barnabas as key partners. But talk about what behavioral health means and what prompted this emphasis for you.
Yeah. So this is something that I think behavioral health is one of those things in this industry that has evolved as people have come to better understand, some of the challenges associated with it and the links to physical health. So as I said before, we understand that people with chronic conditions, are much more likely to have, challenges with depression and anxiety and other behavioral health issues that impact their physical health as well. Conversely, there are, I think the status is close to almost 1 in 3 Americans have some sort of challenge with depression at some point. That then impacts your overall physical well-being and creates other conditions that you're going and having to manage. So making sure that we understand that connectedness, I think there was a stigma associated for so long with many of these issues, and companies were set up to manage them as benefits, as kind of an aside. We recognize that we have to really integrate with primary care and make sure that we're collaborating with the primary care physicians so they're treating the whole person and they can identify these issues and make sure that someone is referred in the right place at the right time, and that those providers are then talking to each other. So that if somebody is going for some treatment of depression, there's a full understanding of what that person, if they're dealing with diabetes or some sort of chronic cardiac condition, they can build that into their treatment plan.
That's terrific, right? That preventative health opportunities is key. So talk about where this industry is going. This is a unique time. We're post-pandemic. Our behaviors have changed. It seems to me that people are more aware of their own well-being. So talk about the future.
Yeah, I think our biggest challenge, and it's no surprise, is going to continue to be both the cost of care and then what we get from the care that we receive.
Right.
So, we've done a lot with our provider partners around, people have heard value-based care. We're really trying to focus at the end of the day, how do we as an industry move us towards outcomes, paying for positive outcomes, understanding that at the end of the day, if we treat the whole well-being of an individual and seek the best possible outcome, it's actually more cost-effective, right? So that we're not just simply throwing money at different procedures and making sure that someone's going through the turnstiles and therefore running up the cost. You think about, I think the cost for a family premium, for a year is somewhere around $22,000.
Wow.
It's absolutely mind-boggling.
Sure.
It's gone up almost 200% since 2000, and that cannot sustain.
Right.
So we have to get to focus on making sure people are getting not only the right care, but in the right place and at the right time. We've got to get to the total cost of care.
Talk about your work in the community, because that, certainly as far as we're concerned, and I think a lot of people in this room, is one of the unique and positive things that Horizon brings to our state, certainly to Newark.
Right.
John Pearson is your leader, and an excellent leader he is. Tell us about some of the programs that you're keenest on and what you see going forward in that work. Yeah,
there's a lot that group does, and I'm not going to do them justice in terms of talking about that, but I will tell you, we have it's in our DNA, not only as a not-profit, but as a company that's 90 years old, steeped, this is where people live, right? So you call it home, so you want to make sure that we're investing in our home. And I think that is a big part of who we are. But I think, even selfishly, I always say it's good business. You think about what we're investing in. So, we were talking with some folks out there about, food insecurity.
Yep.
Okay. So a lot of the work that we do with all of the different food pantries around the state is absolutely critical for the health and well-being of New Jerseyans. When we talk about social determinants of health, one of the major issues is food insecurity, is not getting proper nutrition. So if we can help address some of those needs through the programs that we're investing in, then it's good for New Jersey, it's good for, obviously, our members. And we think of it, we're again investing back in the community that we call home. You know, a lot of the other programs were involved certainly with NJPAC and have made some significant contributions there because it makes sense to, and again, invest in our community. We've talked about this, you and I, before, around the importance of the arts and how important it is when we talk about the well-being of a community, but also, you know, we were talking about behavioral health, the healing power of the arts for people. It is really, really amazing. There's been studies that have been done on this. And so these are all not only good for New Jersey, they're not only good for our communities, they're really good for the health of our people.
Culture of health is a term that that I think we use. Define what that is, a culture of health. Yeah,
so a culture is, there's an old saying out there, I think it was Peter Drucker, you know, culture eats strategy for breakfast. Right? You can have the most incredible strategy, business plan, you know, whatever you want to call it, and go to execute. If you don't have the right culture,
right,
you know, it's not going to go anywhere. Yeah. So making sure that our people, certainly at Horizon, really feel good about coming into work, really feel that they're valued,
right,
but also feel that their contributions are valued, and more importantly, helping identify those behaviors that we expect as an organization of all of our employees. You know, how is it that we work well together with others? How is it that, you know, how do we look at things like working with a sense of integrity and a sense of urgency in everything that we do? How do we invest in leadership so people understand what are the leadership characteristics we're looking for? What are the behaviors that we're expecting? When you can communicate that and be very purposeful in it, you create this incredible healthy culture, culture of excellence, culture of health. It drives people, it gets them excited, and when people are excited and they're passionate about what they're doing, it automatically yields great results. We've actually gone about, the team, we've put together what we call our corporate narrative. It's basically a foldable piece of paper, and it lays out for everybody. Every employee gets it, and we talk about it continually. Not only what our mission is, because we want to remind people, why do we come into work every day? Who are we? What our vision is, and then we talk about our culture, how important that is to driving what it is that we want to do. And we remind ourselves every day, so when we're in meetings, how are we conducting ourselves? How are we working together?
That's great. So as a leader, right, you had to take control of this really massive organization remotely during pandemic. Now you're finally in person, right? Talk about leadership from your perspective. Obviously a subject area expert for sure, but how do you combine that knowledge and your leadership goals?
Yeah, leadership is at the center. It's one of the first words in our definitions around culture.
Right.
And I always, I have this conversation with employees. Every individual has the opportunity to be a leader, regardless of what your title is, how many people report to you, whether you're full-time or part-time. And it's through our actions. Do we inspire others to follow us? Do we work collaboratively with others and get them excited about working with us? So I'm a huge believer in making sure that if we hire the right people and invest in leadership development and have lots of leaders, we will be successful regardless of what our strategy is and where we're going. I'm a big fan of Patrick Lencioni and his leadership style as he's put it out in different books.
Which is what?
Well, it really is, how do we engage as a team? You know, there's certain foundational elements, you know, in terms of how we get together as a team. And a leader focuses on building things like trust and relationships in order to be able to make sure that we're having difficult conversations that maybe we, you know, a lot of people like to avoid difficult conversations. It's natural. No one wants to enter into conflict.
Sure.
That can be uncomfortable. But if you can learn to do it in a constructive way, you find out, well, actually, no, I'm doing right by the other person, by sitting down and having the difficult conversation and say, how do we work through this?
Well, you're also doing right by your business because you're being intentional about issues that have to get addressed.
Exactly.
Right. Passive-aggressive leadership
Yeah.
hardly ever works. Right?
And then admittedly, as people will know, because it's going up in my office, I'm a big fan of Abraham Lincoln, and I've got this life-size.
Oh, man. I don't know.
thing of
You
him.
know, I'm listening to John Meacham's new single volume on Lincoln. Have you read it or heard it?
I haven't read it, but I got my hands on it.
Lincoln, amazingly, there have been more books, a lot of us know this, more books written about Lincoln than anybody else. And John Meacham, this wonderful presidential historian, has a single volume bio of Lincoln right now. Talk about that.
Well, you know, so my favorite Lincoln book is
Yeah.
Team of Rivals
Yes.
with Doris Kearns Goodwin. Because what's great about it is you learn that he was not a perfect human being. Oftentimes we put these leaders on pedestals and we think they have to be perfect for us
Right.
to, and they're not.
Yeah.
We're all flawed,
Yeah.
right? But what he accomplished in pulling people together at a time in our country to keep ultimately our country together and to drive critical change that had to be driven, I mean, it becomes almost overwhelming to think about it. If I was put in that situation, could I do those things? And so just learning how it is that he worked with others, you know, it's intriguing. There was a whole Wall Street Journal section done on it a couple of years ago. I have that pinned in my office as well. It says, what would Lincoln do right, in certain situations? And he was a very thoughtful individual, and while he made mistakes, he always reconsidered his thinking and his thoughts, and he evolved.
He evolved. He evolved. He wasn't stuck.
Right.
Yeah, interesting. Did you have a mentor in business growing up?
I did. You know, when I started at Health Source, I learned under a gentleman by the name of Dr. Norm Payson, who had been the CEO at Health Source. He went on and did some things at Oxford and other things. And I feel like I learned a lot about the business with him, but I also learned a lot about aspects of leadership. He was a big believer in you hire great people and you let those folks do what they need to do. He wasn't a command and control individual. But actually my greatest leadership lesson came when I was 16 years old. And I got my first job at a grocery store. And I was stocking shelves, and the store manager came to me and said, okay, I'm going to put you in charge of this part-time grocery crew. But I want you to know that when they do a good job, I'm going to go and pat everybody on the back. But when there's something wrong, there's only one neck I'm coming for. That was a great leadership lesson.
Got it. Right. Right. Chris Surfer was the school superintendent in Newark some time ago. Always used to talk to me about who's the throat to choke. You know, who's responsible.
Yep.
You know, who's gonna take ownership. Right.
Right.
It's a lot of that.
It's accountability.
So, and then before we get to questions, one final one, and that is a culture question. So you ran a major blue in the state of Pennsylvania, right? And then you come here. This blue is bigger, and this is the state of New Jersey. What's the culture shift? What's the difference between running Capitol and this one?
Well, you know, interestingly, it's probably more just that it's bigger.
Yep.
And so it takes a little bit more effort to see some change happen. Interestingly, there's a lot of similarities. The one thing I find is that it's helpful. We truly have people that care, that love what they do. I mean, we have people that have been with the company for 20, 30, 40 years. I mean, there's a term, they bleed blue, right? And it's because they really care. We have some folks that have been in customer service for 20 years and thinking, how is it you could just be on the phone and deal with problems all day long? And these people see it as almost like their vocation, their mission, that I'm there to try to help solve problems.
Oh, they're saving lives.
Yes.
You know, the customer rep who's getting you the coverage you need is saving your life.
Right.
Yeah.
And so they really care. So there's actually a lot of similarities. I think the biggest thing is that, it's a different marketplace.
Yep.
And, bigger sometimes means bigger issues, right?
Yeah.
And so you've got to work through some of those things. But, the people are great. And I think the community is great. I have to say, there hasn't been a lot of a lot of change in that regard. Being originally from New Hampshire, I'm a little bit closer to home. I've worked in Boston for 4 years, so this actually feels a little closer metropolitan-wise, than Harrisburg.
Sure.
Harrisburg's a little bit of a smaller city, so it's a little different setting that way, but great people.
Well, it really seems like you're having a good time.
You know, I am.
Yeah.
I am. I learned a long time ago, life is too short. Enjoy every moment for what it is. And I see, I just see so many good things at the company and in the state. So there's always a reason to be hopeful.
Excellent. All right. Very Lincoln-esque. Yeah, right. Let's go to you all for questions for Gary. Who would like to start? Well, we'll give it to Joel Sherman, number one.
Thank you. First off, thanks for coming.
Good to be
Very interesting conversation. I'm a big Lincoln guy, so I think what's even more amazing is he did what he did with the technology of the day, okay,
Right.
which was
Exactly.
telegraph.
Right.
Which is,
He didn't have his cell phone.
Right.
no cell phone, just think
Lincoln
about
couldn't
that.
text, right? Yeah,
Not-
right.
no.
Yeah.
And he was married to Mary, which is a whole
That
other
was,
conversation.
it wasn't easy.
So a couple of things, sort of related and sort of not. You brought up pay for positive outcomes. And I would ask you to elaborate on that because I'm pretty close to a few physicians. And I think physicians feel that they are being put in positions that they ultimately can't control. I mean, if they prescribe, a specific medication and the patient doesn't take the medication, they get dinged, which seems crazy to me. So that's one thing. And then the other thing is, when a pharmaceutical, a Walgreens spends $9 billion to buy Summit Health, which is CityMD and Summit Health, you start to ask yourself the question, where is healthcare going and how does it benefit us as patients?
Right.
And I mean, I just think it's a very, very Wild West kind of feel out there for physicians and patients. I would argue that most people in this room are not happy with the responsiveness of healthcare operations to be sensitive to when they want to come in, what they need, and what insurance covers. So I mean, I'm sort of babbling all over.
Is
the place,
there a
but
question?
There's yes.
What the
Where did you
hell?
where did you get that shirt? No, so I think the first thing is pay for positive outcomes. Second piece, what do you see with the Walgreens thing?
Sure.
Thank you.
No, that's great. So I'll take the Walgreens thing first. So it is a very challenging time. So I candidly have concerns with, and that was the situation with Summit for a while, with private equity. Private equity gets engaged, and I understand why. I understand that at the end of the day, a lot of these physician practices, they need capital to invest in some of the things they have to do. And so they have to look for that capital in different ways. It's very hard to compete in this continually changing environment. And so private equity is one form, and then the concern is, well, great, at the end of the day, private equity is going to be interested in trying to, to sell that off and get their profit. It's part of, their business model, and there's nothing wrong with that at all. But what it does in terms of healthcare is it creates these challenges, and so you end up with these large systems. So you talk about not only the large healthcare systems here in New Jersey, but all around the country, where hospital systems are feeling like, well, for us to be able to make sure we have some control, we've got to acquire these physician practices. You have players like United that come in with Optum that then want to expand, and so you have the independent players like Summit and a lot of the smaller ones, who are saying, okay, so what does that mean for how do we compete in this market? So they look for alternatives. Thankfully, with the Walgreens, I think that we at least ended up in a situation where their investment in that through Village MD will allow that that group of doctors to continue operating as they were in a way that hopefully will yield good results down the road. We actually happen to have an incredibly strong relationship with Summit. And we're excited that that's going to continue. They're actually a very high-performing provider group in that regard. And so we're hopeful that where it ended up will yield a better result than if they had ended up in someone else's hands. And so we're going to continue to work closely with them as we go forward. On the pay for outcomes, that's always the challenge. And pay for outcomes is a very broad term.
Can you explain what that means?
Yeah, so what it means is, you think of traditional fee-for-service medicine, which is every time you go and get a procedure, every time you have a test, every time you make a visit, you're making a payment. So fee-for-service is for every encounter that I have, you're going to make a payment. Pay for outcomes, there's some level of that fee-for-service payment that goes on, but what it says is, at the end of the day, I'm going to reward you based on the outcome of the totality of care that's been provided. So if I have, use an example, a hip replacement, rather than paying individually for every aspect of that hip replacement, and then when you get an infection, you go back into the hospital, and I'm going to pay for, addressing that infection and all the care that follows up. I'm actually going to look at that hip replacement and say, what does a normal hip replacement cost, and what's a good outcome? And I will pay you a bonus if, after you've done that hip replacement, you had the right outcome, there was an infection, the patient ended up in the right recovery. Now you, as the physician or as the hospital system, depending on who the arrangement is with, is going to get paid additional amounts. So we're providing incentives for what would be the right kind of outcome. And at the end of the day, that will still be far less expensive than when you look at, having to pay for each and every service, paying for the readmission on a case where you get an infection or whatever other complications may come from it.
Oh, that's fascinating. Yes.
Hi, my name is Laura Jennings-Pitt with Prevention is Key. We do services around substance use disorder. And so I was really interested in the stuff you were saying about behavioral health, because that's just so important. And I didn't do my research ahead of time, but I did find, while I was sitting here paying attention, something that the Horizon Blue Cross Blue Shield Association put together on addressing America's opioid crisis. And it outlined that the Horizon Blue Cross Blue Shield of New Jersey actually was piloting a program with peer support specialists reporting to the emergency room. I don't know when the report was produced, but I was really interested in learning more about that and wondering if the pilot program is underway and if there's been any successes to share. We do similar work. We respond to the emergency room as well. So I just was curious, as an insurance provider that's really innovative, and I was wondering what you've seen happen as a result of it.
Well, I would like to be able to speak to the results, but I don't have the data with me, so I want to be careful not to delve into something that I'll get in trouble for. There's a few people from Horizon here in the room that would probably get me in trouble. But I would be very happy to hook you up. Jen Velez is sitting here, and she can. There you go, real time.
Perfect. That's what it's all about, pal. Right.
But it is an example, I will tell you, about when we talk about where the industry is going, the things that we're willing to do and invest in a way that traditional insurance just didn't do in the past. Because we're seeing that at the end of the day, it's the outcome that matters, and we have to think creatively and differently about how we deliver that. Now, we don't deliver the care, but there's a lot that we can do to enable what we would say are the right behaviors, both with our providers but also with our members. And so if there's some things that we can do, and at the end of the day, we talked about our move to a not-for-profit mutual. We have now the ability to invest in some of these things. I'm a big believer in innovation, and innovation is not always about technology. It's about thinking differently, and it's also about being willing to fail, right? There's going to be things we try that we find that, okay, this didn't work, or this wasn't the right way to go about it. You have to be willing to make those steps, risk a little bit of something, and then if you're going to fail quickly and move on to the next thing to get where you need to go.
Right. Yes, Lori.
Hi, I'm Lori Spoon. I'm with Berkshire Hathaway Specialty, which is on the other side of insurance, on the P&C side. Thank you so much. I really enjoyed talking with you beforehand, and everything you said about culture is really resonant, and I can understand what a great leader you are and the leadership that you've developed on the team. Two things. One, quick question, and then your perspective on something. Quick question. What was Patrick's last name, the author?
Patrick
Oh,
Lencioni. I'm sorry.
Lencioni.
Lencioni.
So you know what? Maybe
L-E-N, yeah.
when we send a note out to everybody following your talk, we can include your favorite book by him.
Yes.
For folks to look at.
The 5
Yeah.
dysfunctions of a team.
The 5, only 5, you know, right?
Well, he tried to be limited. And it's
Yeah.
an easy read because it reads like a novel. He tells it as
Oh,
a
really?
story, so you'll
Oh,
love
that's
it.
cool.
Oh,
Yeah.
thank you. So the other thing is, it's not yours to solve, but it affects you. I grew up. My father was the hospital administrator and of a big hospital in Indiana, and every dinner conversation was about a culture of caring. And it's really disturbing. We talked to risk managers of large healthcare systems and the challenges in terms of contract labor, underqualified staff to patient ratios.
Right.
Just curious, sort of your perspective on that, where you see it going.
Yeah, we are entering what I think is, I want to say a new normal, but a shift in all of that. You know, and every market's a little bit different, but I do think we're gonna have to figure that out, because I do think that, you know, part of this is lifestyles. COVID changed a lot of things for a lot of people. It really made them
In a
think
good way
different.
or a bad way?
Both. You know, I think in a good way from a personal standpoint, right? We all revisited what's important to us. How am I going to spend my time? You know, and so for a lot of people are like, why am I, you know, doing this and giving all of this up? So if I'm going to do this, I'm going to do it. I'm going to do it in a different way, or I'm going to take a different approach. Now the challenge with that is we lose out on a lot of things that were so beneficial and candidly we probably took for granted, especially as employers. And so it's going to be incumbent on employers to think about how do we reinvest in our employees, make them feel valued, make them want to come and do the things that we need them to do. But, you know, how are we going to support them differently than maybe we did in the past?
Yes, right there, yep.
Hi, good morning. Elizabeth Trainer from RWJ Barnabas Health. You spoke about the paying for outcomes, and I think a lot of us in this healthcare space, and I'm on the social impact team with the organization, addressing food insecurity and things of that nature, it feels like we're putting the finger in the dam or slapping the Band-Aid on it, so to speak, addressing it at the end of the stage. What is Horizon doing to address the upstream issues and the root causes of what really makes people healthy, or the social determinants of health, or policy change, or anything at that nature, if so?
Yeah, that's a great question, and we actually have, we've invested heavily in some programs and some partnerships. We've actually worked with RWJ, Barnabas on some of this, about going out in the communities, understanding, so what is driving it? So maternal health is a great example, right? Where there's some real challenges, especially in mortality rates, especially in really some of the underserved communities. Why is that? And what can we do to address some of those issues? So we're actually doing some things. Actually, the First Lady is very involved in that particular issue, and we've engaged with her and with some of our provider partners like RWJ, Barnabas, to figure out how can we make some investments early on in maternal care so that by the time the healthcare event happens, you know, we've significantly at least mitigated or reduced some of the risks that end up by resulting in, you know, not only complicated, costly cases, but, you know, much higher mortality rates than we ought to be seeing in this part of the world, right?
We have time, I think, for 2 more questions. Sir.
Hi, I'm Kwesi from Handspring Health. We are a pediatric mental health startup based here in New Jersey. As you know, most mental health conditions start off when people are under 18. And so in some way addressing pediatric mental health is, as you think about preventative care and mental health, that population is very powerful as you think about long term. We'd love to hear your thoughts around the different things that Horizon is doing specifically for the pediatric population and mental health.
Yeah, so Suzanne Kunis, I'm going to, again, connect you with Jen over here. Jen Velez heads up our health network solutions include behavioral health, and Suzanne Kunis, who heads up NovaWell for us. But part of this is creating, important partnerships. So quite frankly, with organizations, providers like yourself, that can really figure out how to address some of these issues early on and how do we invest. So again, what I'd like to do is maybe connect you with Jen where we can delve into that a little bit more deeply.
And
I saw one over there, straight ahead.
right there.
Hi, my name is Deanna Christian. I'm a corporate attorney at Sherman Atlas, a small full-service firm in Florham Park. I heard you talk about a little bit about your leadership teams and leadership development. I'm just wondering how diversity in leadership fits in to the plan at Horizon and how that has impacted your culture and also health outcomes.
Yeah, that's a great question. We probably don't have the full hour that it would take to go through that. So, and I'm going to call out again Allison Banks-Moore, who heads up, who's our Chief Diversity Officer and is on my team. We actually put that in, so our culture of excellence definition, first thing is around leadership, and we address leadership in different areas. One of those is in diversity, equity, and inclusion. And we put a pledge together back in 2020 that said, what we're going to be committed to. And that pledge went beyond words. We actually created an action plan that we're accountable to our board for, that we go back on. But we're making significant investments in leadership development and succession planning. And we've made some significant strides as we continue to try to increase our diversity within all the ranks of our employees. While I think Horizon, I would like to say, had a great reputation when I came here, so I can't take full credit for where we're at. But I will tell you that we've had a renewed focus, and we know there's a lot more we can be doing. As part of our mutualization, we made a real commitment to address that throughout all of our ranks. We have an extremely diverse board of directors that helps keep us accountable to make sure that we're driving that throughout. Allison could probably spend hours around some of the leadership development programs.
Get up here, Allison. Come on.
Where we've
like
really
the third hour of the Today Show. Come on.
We're investing in our employees, and we have special internship programs, but special development programs focused on minority and women to really make sure that they're getting as much opportunity as possible, so that we're trying to level that playing field over time. So I think we're making great strides. Candidly, we still have a ways to go. I don't think we'll ever be there.
I think every business does,
Yeah.
right? So this is a good way to end, because I wanted to say to you, on behalf of all of us at NJPAC, and I think on behalf of a lot of nonprofits, whether they're arts nonprofits or social service organizations up and down the state, you guys really not only talk the talk, you literally walk the walk, and you have a genuine, authentic interest in the well-being of our community, whether that's through the services you provide in the business or the way the foundation engages with community, which is unusual and really laudatory. So thank you for that. And thanks for coming out. This is sort of, this is your first, I think, your first sort of foray into this sort of setting. So you're
and depending on the results, it may be my last. I don't know.
Gary St. Hilaire, there he is.
Thank you. Thank you. Thank you.
Thank you.